This is WBOC News at 6, Delmarva's news leader.
We're all in this together, and we will get that through this together.
Maryland Governor Larry Hogan today announcing new measures in the state's COVID-19 response. Good evening, everybody. Thanks for joining us tonight at 6. I'm Steve Hammond. Once again, we are tracking several developments. First, Maryland public schools will remain closed for an additional 4 weeks. Governor Hogan also announced plans to ensure that those on the front lines of the coronavirus battle get the child care that they need. An important reminder tonight for senior citizens of a first-in-the-nation call check program to help ensure the well-being of seniors in Maryland. And Delaware Governor John Carney sits down one-on-one with WBOC talking about his state's preparedness if the number of cases were to dramatically spike. But we begin tonight with education. Students in Maryland public schools will be out even longer. WBOC's Chris Weimer joins us tonight in the Newsplex. And Chris, the state superintendent of the schools, extended the closure of schools for another 4 weeks.
Yeah, Steve, schools will remain closed until at least April 24th. That news announced this morning during a press conference held by Governor Larry Hogan.
With COVID-19 cases still on the rise, Governor Larry Hogan and the state superintendent of schools announced an extended closure of all public schools until April 24th.
Obviously, we're not going to send kids back if things are unsafe and we're still climbing and people are getting infected.
We do not make this decision lightly.
In terms of what will happen during the extended closure, Salmon says continuity of learning is the first step, finding a plan that allows students in all parts of the state to continue their education away from school, something that could come with a challenge as some rural areas lack internet access and other families may not be able to afford the technology needed to learn online.
What are the standards that we really expect to have to be the baseline that everybody gets? And then if other districts are able, because they can do more remote distance learning, they can add on to that. But we want to make sure every student has the basics going forward this next 4 weeks.
Superintendents throughout the state have provided information and plans on how best to continue education during this time. Salmon says her office is currently reviewing the plans and finding out what state resources can be made available to assist. She expects the continuity of learning plan to resume for students next week.
More information will be coming down, she says, in the next couple days that outlines a statewide plan for educating students. Both Salmon and Hogan say it is too early to definitively say when schools may open back up.
All right, Chris, thank you. With schools now closed in Maryland until April 24th, parents are obviously concerned about how their students will learn during this time off. WBOC's Faith Woodard spoke to school leaders across Maryland's Lower Shore about their plans moving forward.
School districts like Wicomico County are planning for what's next. Training staff and overcoming technological limitations are on the forefront.
We've been doing the most recently is surveying our staff, and we are in the midst of surveying our students and our families to find out what their capability is at home.
Worcester County Public Schools will begin training teachers for online learning next week.
We have ordered additional hotspots to pass out to our kids to help them. We have also looked at a packet or paper pencil type process that we will deliver to our kids who are not able to get that internet connection or have that device available.
Somerset County schools are working through limited high-speed internet access.
We'll link up everything to our county webpage. We'll also link up to the school web pages as well as our Facebook presence. We're going to have these packets available when we do meal distribution. We do that every Monday, Wednesday, and Friday.
Dorchester County schools are planning on packets, but they hope to also plan to send home computers to students who lack access.
We're also planning on pushing out 1,000 computers to our secondary high schools, our 2 high schools, because obviously graduation and moving toward graduation is a key component.
In terms of grading, how do we go about ensuring that every student is graded equitably, regardless of their resources? And in terms of standardized testing, are there talks at this time of waiving standardized testing?
Again, this is not set in stone, but we're talking like pass-fail type situations.
There's talk of a waiver of state testing, which there should be.
I don't want to hold any kids hostage for a grade. It's not about grade, it's about learning.
COVID-19 forcing new lessons on learning for students across Delmarva. Faith Woodard, WBOC News, Delmarva's news leader.
And certainly challenges ahead for schools and teachers. Now back to Wicomico County for a moment. Parents in Wicomico are being asked to fill out the home technology survey that was emailed out. That survey can also be found on their school's website. Now, the longer that schools are closed in Maryland, the longer some parents need help from daycare centers. And today, state leaders urge daycare centers to stay open. As WBOC's Kate Douglas shows us, some daycare centers in Wicomico County are working hard, especially to meet the needs of essential personnel.
Helping families on the front lines of the COVID-19 outbreak.
We're surviving. We're trying to stay open for our essential personnel.
Some centers, like Stepping Stones Learning Academy in Fruitland, are upping their protocols to protect children, families, and staff.
Right now, we've asked parents not to come any further than our lobby. Students will be taken to their classrooms or called up front on dismissal times. We have also, of course, we're following the OCC guidelines and Governor Hogan's suggestions of a 9-to-1 ratio.
It's a similar routine for Corner Campus in Salisbury.
I don't think people touch a light switch or a doorknob or a countertop where it isn't wiped off. We're trying to do everything we can to limit possible exposure.
Both centers saying kids should stay home if they or their family members aren't feeling well. All of this as health officials learn children can carry and show symptoms of the virus. Sherelle Williams says the idea of children spreading the virus has been a concern from the start.
You know, one of the heavy things that weigh on me and in trying to make decisions are, do we stay open, not just to meet the community needs, but to be able to meet the needs of our employees? And then you also have to think about the value in human life. You know, is it more important to close down for a couple weeks, give things time to settle? But on the same token, people need care for their children.
Staying open to help essential employees. Reporting in Wicomico County, Kate Douglas, WBOC News, Delmarva's news leader.
Now, any essential personnel who need help finding care for their children can call that state hotline in Maryland. There it is on your screen. Many centers we spoke with urge parents also to keep their children home if they don't need to put them in daycare. Governor Hogan also reminding seniors that they can receive daily calls to check on their well-being amid this pandemic. This is a first-in-the-nation free service for all Marylanders over the age of 65. To enroll, call that number on your screen, 1-866-502-0560. You can choose a 1-hour time window between 8 a.m. and 4 p.m. for your scheduled call. And if you miss the call, there will be 2 more phone call attempts. If those calls go unanswered, an alternate person who you choose when you register, similar to an emergency contact, will be called and urged to check in on that senior. The phone calls will provide messages and updates regarding the COVID-19 outbreak. More details on the enrollment can be found on our website and the WBOC News app. Maryland Governor Hogan also asking former medical workers to volunteer for the Reserve Medical Corps, and the state is allowing and really calling for medical and nursing students to volunteer, even if they are still in school. They could bring some much needed help. WBOC's Zach Parn spoke with a worker in the field already about how she's holding up.
Hey everyone, so I'm working from home today, but not everyone has that luxury. Medical personnel and first responders are taking big risks.
Life's got to be pretty crazy for you right now. Can you just walk me through, what's going on day to day?
Well, things obviously are changing every day. I came into work this morning and now they want us to wear masks all day, every day. A lot of people are, really nervous, and they have every right to be. It's constantly washing your hands, using hand sanitizer, wearing gloves, wearing masks.
Taylor Smith has been hard at work in her hospital in Maryland, but sometimes she wishes things were a little different.
I just would love to take the time to just stay home and make sure that I don't get it. And some of these people that are, able to be quarantined that don't stay home, it does make it hard because it's really not going to go away if people don't start staying home.
Smith is a huge preacher of social distancing. She says it's the most effective method of prevention.
It is hard when you work in healthcare because, we're constantly around people. I'm in a procedure area with 4 people and I have a patient there, and then, some of these procedure areas aren't very big.
It may seem like doom and gloom, but she's keeping her chin up.
I'm doing pretty good. I constantly am wearing a mask and washing my hands, so I'm trying not to get it. I know that I work in healthcare, so I have to be nervous, but again, working in healthcare, I know that I'm going to come in contact with it at some point.
So to Taylor and all the other first responders, a big thank you from those inside our own walls. In Wacomico County, Zach Parnes, WBOC, Delmarva's news leader.
So if it were to happen, is Delaware equipped to handle a major spike in COVID-19 cases like what we're seeing in New York City? Our Kent County Bureau Chief Tom Lehman spoke with Governor John Carney today about the state's readiness and how Delaware may take additional steps that would restrict everyday life.
Since announcing the first COVID-19 case in Delaware, Governor John Carney has issued a state of emergency and several orders aimed at preventing the spread of a coronavirus that's infected more than 100 Delawareans that we know of.
We haven't tested everybody who is symptomatic.
Carney said in an interview that he's hopeful Delaware will not have to open makeshift hospitals like the ones being built in New York. If those facilities are needed, one location that could be used here in Delaware as a makeshift hospital is the old Milford Memorial Hospital.
They have beds, they're basically ready to go. We could probably deploy that in 3 or 4 days.
Carney has also shut down a lot of businesses deemed non-essential to help prevent the spread of COVID-19. But the governor says there needs to be more social distancing in stores allowed to stay open and at construction sites.
They really do have to impose restrictions on those work sites so that they're doing that. And I've told those business owners that if we can't do that, then we'll have to close them down as well.
Carney says he understands closing businesses and schools until at least May 15th will hurt many Delawareans right now. But the governor is not optimistic those closures will be lifted earlier than planned.
If we don't shoulder a little bit of pain now to prevent the surge, an uncontrollable surge in our hospitals across our state, that would really threaten the lives of so many Delawareans, particularly our senior citizens.
To that end, Carney says the government cannot alone stop the spread of COVID-19, and Delawareans need to do their part by staying home. Reporting in Dover, Tom Lehman, WBOC News, Delmarva's news leader.
A massive stimulus bill in Washington meant to ease the financial pain of this outbreak. WBOC's Todd Carley joins us with that part of the story. Todd, what do we know, at least at this hour?
Well, Steve, as optimistic as everybody is about this bill in Washington, it is not a done deal yet. Right now, Senate leaders are trying to unravel some last-minute snags. Now, assuming the full Senate does pass this bill, it has to get through the Democratic-led House before it gets to President Trump. Now, as it stands now, here are some of the highlights. First, that bill would provide one-time direct payments to Americans of $1,200 per adult. That's for people making up to $99,000 a year. It does phase out for people with an adjusted gross income of $75,000. Married couples would get $2,400. This does include $500 payments per child in addition. I know there's a lot of numbers there. The package would help replace the salaries of furloughed workers for 4 months with gig workers like Uber drivers covered for the first time. The package also contains $15.5 billion more for a surge in demand for food stamps. It would also expand unemployment benefits and provide $367 billion for small businesses trying to keep making payroll while workers are forced to stay home. So there is a lot in, and that's just scratching the surface. This is an unparalleled $2 trillion economic rescue package that makes it by far the largest relief bill in history. Of course, an update coming up tonight on the news at 10 on Fox 21.